always equate snoring and sleep apnea to diabetes. There might not be a cure, but what do you do with diabetes? You mitigate symptoms. You can give someone GLP. You can diet, exercise. Well, with snoring and sleep apnea, it's CPAP. It's a device. It's a pillow. It's breathing exercises. It's the right supplement to take at night. It's sleep hygiene. Go to sleep. You know, regularity. You listen to Matthew Walker, who always talks about like regularity is probably one of the most important things. So I think it's all these adjuncts.